Good evening, everybody, and welcome to the 7th debate of term, which is, this House would privatise the NHS. Just a few rules to run through, which, if you've attended many times before, I'm sure you're bored of now. But for those of you that are new in the audience, including Parkside School, we're very happy to have you here this evening. Just a sort of few rules of conduct. There'll be 6 paper speakers this evening, 3 from the proposition and then 3 from the opposition. In between the first round of paper speeches, there'll be the opportunity for a floor speech, which is where you guys get the opportunity to speak for 2 or 3 minutes on the proposition, opposition, and then an abstention. We then return to a round of paper speeches, followed by floor speeches, and then finally the final round of paper speeches. You also have the opportunity to interject if someone says something you disagree with or you'd like further clarification. Just raise your hand and say, on that point, points of information, and the speakers can decide whether to accept or decline. And for a sort of an exciting debate, I do encourage you to make those. The floor speech prize this evening is a comprehensive collection of the Penguin Classics books. So that's what the best floor speech prize will get. But now moving on to the paper speakers, I'd like to invite the first speaker for the proposition to speak, Zoe Zhang. Zoe is an MPhil student of Theology, Religion and Philosophy of Religion studying at Gonville and Keyes College. She's on the right to speak through open audition. You have the ears of the House.
So I think we can all agree in this chamber that the NHS is kind of broken. And we can see this in the fact that British patients are increasingly turning to private healthcare as the salvation for all their ills. There were 898,000 admissions to private hospitals in 2023. That's more than any year since records began in 2016. And this represents a 7% rise in the number of times that people opted for private treatments since 2022. NHS England patients were waiting for about 7.5 million appointments at the end of March 2024. That's a pretty staggering number. And the recent Darcy report that's come out has been published by the new government we have in Westminster has found that someone arriving for treatment at A&E in 2009 could expect about 40 people in front of them in the line. That number has skyrocketed this year to up to 100 people. And such delays may have resulted in as many as 268 additional deaths per week in 2023, nearly 14,000 over the year as a whole. When we compare ourselves to peer countries of a similar income bracket, of a similar GDP, we have substantially fewer key physical resources, including CT scanners, MRI scanners, and hospital beds. We also have the lowest number of doctors per 1,000 patients in all of Western Europe. And British nurses rank 3rd lowest in terms of their availability to patients. That's ahead of only Italy and Spain in all of Western Europe. This is due not only to staff stress, but also incredibly uncompetitive pay. Many of my medic friends at Cambridge are saying, as soon as I get my degree, I'm off to Australia, I'm off to the US. At least I won't be living on peanuts. At least I won't be living on a pittance. And moreover, compared to our peer countries, the UK also has higher avoidable mortality and treatable mortality rates. And a lot of those are for major cancers, sadly. Cancer of the breast, cervix, colon, rectum, lung, and stomach. Long term, it seems that people are just going to keep on choosing private options. And this popularity probably is going to, well, maybe not kill the NHS, I don't wish to be that dramatic, but it certainly will have very negative ramifications for the workability of the NHS as an organisation. Most private hospitals are not equipped with intensive emergency facilities to the level that the NHS is. And so therefore, this means that they will take on simpler cases and the NHS will take on more complex cases, decreasing the quality of care that the NHS provides even further. We're going to see those mortality rates keep on going up. Moreover, increased demand for private work will mean probably the best doctors get siphoned off towards the private sector. And where does this leave the NHS? It will leave it hollowed out, a shell of its former self, and barely capable, I would think, of providing any care worth having in a developed country. My argument is simply, why not make it all private? And in case anyone's going to start saying, oh, you don't agree with universal healthcare coverage then, don't worry, I'll get to that at the end of the speech. But for now, let's focus on the reasons why people are increasingly choosing private care. Simply put, the budget for a national healthcare service like the UK's is only ever one spending priority amongst many for a government. And it's always going to be vulnerable to tax cuts because what else is important? Let's think. Healthcare is a thief, Jennifer Dixon says. In the public sector, it's always going to rub up against education, support for older people, preserving the environment, investment in cultures, all of these things which a lot of people in Western liberal democracies would think the state is meant to provide. And increasing spending on healthcare, yes, Sammy?
There's no evidence that in countries with private systems, governments spend less. They in fact spend more to subsidise private healthcare. The United States, for example, spends 16% of its GDP, the highest of anywhere in the world. So how can you say that flogging more of it will somehow reduce prices for the government?
There's many other problems with the US system as to why prices are skyrocketing in the US system. It's often because when it comes to Medicare and Medicaid and Medicare, yes, two different things actually. But essentially, the patents granted are so restricted. I mean, insulin only has about 3 producers in the US. This creates a massive monopoly in the markets, and the prices of insulin just go up, 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 up. So it's not necessarily a privatization problem. It may actually be a monopoly problem. But to move on, also, I do believe, on that point actually, without price competition from private insurers, governments are free to pay whatever they want for healthcare services. For a pharmaceutical company coming into the UK, the NHS is basically the country's market. The private healthcare market in this country is negligible compared to the NHS. And so if you don't sell to the NHS, you have no market share. This gives the NHS a really, really, really strong hand in pricing negotiation and discounts based on volume sales. Thus, we can conclude, basically, that single-payer universal healthcare systems like the NHS, they're both cost inefficient and often lack the funding needed to cover their costs. Now, I know in this country it's kind of anathema to say that maybe healthcare providers could be for profit because it just sounds wrong. We don't want healthcare to be profit. We don't want people to be, milking ill people for money. But realistically, if companies are making a profit, they're doing it by keeping costs low and improving their efficiency of operations. There's nothing intrinsically evil about profit. There are many other problems with a single-payer universal healthcare system, like the one we have here as well. The only way a nationalised healthcare program can realistically hope to keep costs in line is to enforce strict schedules of permissible treatments for all illnesses. This means we look at empirical studies to detail the cost effectiveness of so-and-so treatment, and a lot of therapeutic measures that kind of fail to come to the stipulated benefit per dollar level. We simply won't include them in healthcare provisions. And so in a country like the UK where, you pay automatically for the NHS through taxation, you probably, if there is a type of treatment that you want that isn't offered on the NHS, you just won't be able to afford it. Right? And overall, decreased reimbursement prevents hospitals from investing in new healthcare technologies or trying innovative new therapies. We're just going to be lagging behind on innovation in our healthcare system for a long, long time to come. And the bigger question here is, how is this possibly fair for autonomous beings? I'm a classical liberal. I believe in the autonomy of the human being first and foremost. And nationalised healthcare is just not going to cut it in this regard, I don't think. I think it's a lot better, perhaps, to choose an insurance model. Under the NHS, we're told exactly how much healthcare coverage we deserve, what kind of healthcare provisions we're entitled to. The government decides that for us automatically. We put in our taxes, and then we access that through national hospitals. But sometimes it may seem obvious to a lot of you in this chamber that if you had cancer, you seek chemotherapy treatment. And you may think that people who have cancer and don't seek chemotherapy treatment or refuse it are a little bit thick. But is that our moral judgment to make? Between 3% and 19% of all cancer patients refuse chemotherapy. And I may not agree with that scientifically. I might think it's a bad idea. But frankly, is it fair for them to be forced to pay for chemotherapy coverage by the government when they're realistically never going to use that service? I do believe that individuals should be allowed to make decisions regarding the the amount of healthcare coverage, the extent of healthcare coverage that they're going to be able to access. Yeah, wherever that was coming from.
Access healthcare if they can't afford it.
We will get onto that at the end of the speech, where I will tell you, shockingly, that I actually believe in the right to healthcare. But moving on, it seems to me that people have different priorities when it comes to the amount of healthcare they want. Some people may be very sensitive to extending their life as long as possible. They may want to choose a very comprehensive insurance plan, one that might be quite expensive. But I also remember in 2016, this popped up to me this morning when I was writing my speech, or this afternoon rather. But I remember a woman who in 2016, once her kidneys had failed, but she refused dialysis because she didn't want to lose her spark. Thank you, Leonas. And so it's clear that I think people should be allowed, I know it sounds dumb, but to choose an insurance healthcare plan where you might die if you need kidney dialysis. Okay, it's 1 minute left, so no points of information. Sorry. But at the end of the day, I do actually believe in the right to healthcare because realistically, physical well-being is the precondition of autonomy. Life, liberty, and the acquisition of property are all only able to be enjoyed in conjunction with good health. But I don't think the NHS is the way to achieve that. I think we need private provision, possibly, under the Swiss system. I would like to see this combined with cash grants or health vouchers for those that are unable to purchase private healthcare using their own means. I'd like to see people covered by some kind of healthcare guarantee. I'd like to know that people are able to make the best of their lives with a healthy body, but I simply do not think that the NHS is the way to achieve that, and I would like to see healthcare in this country delivered by private providers. Thank you all.